In complementing the efforts towards the fight against COVID-19, which is a global pandemic, a local non-governmental organization, Dziwa Science and Technology Dsat, is calling for concerted efforts and collaboration among different stakeholders. Dsat Executive Director Veronica Mwaba says with the prevailing cases that keep increasing in the wake of the third wave of the disease, it calls for all efforts from all sectors of society to eradicate it. Ms. Mwaba explains that the reality of the devastating effects of the disease cannot be ignored, and therefore the urgency to cooperate towards eradicating it. She says Dsat has since partnered with the Ministry of Health, among other stakeholders, towards this noble cause of ensuring continued adherence to the COVID guidelines and also advocacy as well as public sensitization on the disease.
Audience should not ignore the reality on the ground that COVID-19 is present. COVID-19, it's killing people. Zambia has not been spared. The world is still struggling to find a permanent solution.
And Director of Communication, Information and Research, Ms. Lucy Muzianga Liwewe, says information is key and critical towards fighting the pandemic. And also it acts as a catalyst towards influencing people's behaviors in relation to the disease.
The ones who can send out the correct messages, the correct information, timely. I know you always talk about the scoop or something like that. The scoop is very important. I understand that the scoop is critical and important for a measure on how your media house is doing. But it is key and critical that that information that you share at that time is accurate. It is correct. The third wave is here. It is more ferocious. We have more people getting into the healthcare facilities. We have more people requiring oxygen again. We have more people who are critically ill. We have children also getting infected with COVID-19. That is the important message. And the only way for us to curtail the COVID-19 is to ensure that we adhere to the 5 golden rules.
Meanwhile, complementing Ms. Liwewe's statement, Dr. Kalangwa Kalangwa from the Ministry of Health says to this effect, government has embarked on a risk communication strategy, which is aimed at engaging different community members, such as duty bearers and community members themselves, on eradication methods.
But what we're seeing is people are not wearing masks. But the answer is the responsibility falls on each and every individual. So this pandemic calls for collective responsibility, unit of purpose. If you are walking, you find someone is not wearing a mask, you have the power to actually tell them to wear their mask. So why do we engage communities? So what people do or do not do has an impact on disease or outbreak prevention, control, and success. Therefore, depends on their active participation and contribution. Then understanding how the community perceives and comprehends disease before strategies to affect behaviors are designed is very critical. It's very critical to understand how the community perceives the problem.
The concerned members were speaking in Lusaka on the 10th of June 2021 during a media and science engagement on the fight against COVID-19. Zambia has recorded about 2,146 new cases in the last 24 hours. This is according to statistics from the Ministry of Health. Reporting for Movie TV News, Namangolwa Mundia.